Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Newspart Interlude. This audio podcast is part of a Storm and Squala. This audio podcast as part of a Storm Robotics production. And through this audio podcast interlude, this audio podcast interlude look at sort of works in regard to looking at a long-term condition and health, long-term conditions and health inequalities, and looking at kidney care for all, and where it's originally where this sort of where this context was put forward for a particular remit a remit in regard to 2022, and as part of World Kidney Day 2022. However, being 2024 now, the the ov- the context of the basis is in regard to kidney care for all, and in regard to health inequalities, and looking at health inequalities or aspects of health inequalities is still forms a very important or pivotal aspect of healthcare services, as part of healthcare services. So, in the United Kingdom, unfortunately, one of the main issues surrounding healthcare is that patients or recipients with illnesses like chronic kidney disease or CKD can be or are restricted to NHS or National Health Services, and at times approaching healthcare providers. Further complications can arise, especially for those who have healthcare challenges, and where misinformation can lead to fragility and health inequalities. Patient and public involvement, or PPI, can help bridge issues surrounding health inequalities. In regard to the aims, in regards to the aims were to identify, number one, or sought to identify one, whether healthcare service users would approach healthcare professionals and patients and recipients through online consultations, and through online consultations, and through online consultations, thus prompting collaborative efforts. And two, to understand if and whether chronic kidney disease recipients or CKD patients or recipients would welcome more integrated support from healthcare professionals through social media, wherein healthcare service users and healthcare service providers can bridge gaps across health inequalities. In regard to the methodology, and as a part of World Kidney Day 2022, as part of World Kidney Day 2022, the work sought to highlight how health inequality can be bridged through online spaces and integrative practices between healthcare service users and healthcare service providers. In regards to the discussion and sort of conclusions, recipients or patients are intermediaries between primary and secondary healthcare services. CKD recipients or patients now have more opportunities, or have opportunities to share lived experiences, owing to the nature and implementation of social media platforms such as the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS group for kids. In regard to the sort of the sort of summary aspects, conclusion and summary aspects, in addition to sharing experiences, this prompts healthcare service users to be more than mere recipients of healthcare. CKD recipients become more empowered, so that more informed decisions can be made. Educational intercessions, for example, are required generally to offset issues where there are inequalities, but also to ensure excellence in health and healthcare practices. Some terminologies that can be used to identify similar works include healthcare, education, screening and long-term conditions or long-standing conditions. That draws this audio podcast to a close. This audio podcast as part of a Newspart interlude. This audio podcast is part of a Ztorm and Squala. This audio podcast as part of a Ztorm Logistics production.